So September is Ovarian Cancer and Cervical Cancer Awareness Month, and we're gearing up and collaborating with Stanley Subaru to bring the awareness of ovarian cancer and cervical cancer to Washington, Hancock County. It is a silent killer for women. 1 in 78 women are diagnosed, and every 24 minutes a lady is diagnosed with cervical cancer or ovarian cancer. It's very serious because there is no screenings for it, and it's a silent killer because you really, the signs and symptoms mimic other chronic diseases that women have. So it's like bloating, frequently urinating, have to go to the bathroom, pelvic pain, back pain, heartburn, feeling full really fast, and just thinking that, you know, you've got heartburn, you got reflux, or, you know, whatever, but it's really due to having first stages of ovarian cancer. Well, they should, any woman in the United States that should become part of their preventative maintenance. They should find out what their BRCA1 and 2 is. This gene test that you can have taken. You know your family history, your risk factor, and there is now a blood test that you can have. It's a CA125, I think it is, that you can have done, and then having routine ultrasound, pelvic ultrasounds, if you know that what your risk factors are. Women who have severe menstrual cycles should be having it also, just because it can be disguised as bad menstrual cycles. The ultrasound can be done at any hospital. A lot of the OBGYN offices has the ultrasound systems in their office, so they can do them. But primary care doctors that's where you need to start when you go for your routine annual visit with your primary care, getting caught up on your blood work, you know, just seeing what your heart rate is, all of those stats. You can also ask to be screened for cancers, and one of them for women would be for ovarian cancer and cervical cancers, and to ask for a referral to have an ultrasound done, have the blood work done. Any primary care can do those things. I'm very, well, cancer in general is kind of my thing. I'm very passionate about it. I was a cancer patient navigator for many years. So I advocate for women, for men, families. So for me, it's when I go to the doctor, they kind of like look at me like, okay, can you just give me your list of what you want? But yes, no, it's very important. One of the things that is also important to know as a parent of having children is to look at the PAVA vaccine and ask your pediatricians and your primary care doctors to make sure that your children are vaccinated against that virus that causes those types of cancers. So that's where you can start if you're a family, men, women can still do it. So also when you go to ask, you know, to have, you know, the BRCA test, which is 1 and 2, is also, it encompasses other cancers for women too. So that's breast cancer, would cover that and stuff. And just to know what your genes are, what your family history, anybody can start with their family history. Ask questions. When you have Thanksgiving dinner, it could be, you know, the topic with grandma and grandpa, like, oh, what did illnesses or cancers did your parents have, their parents have, you know, and just look at that and document it and write it down and get it into your electronic medical record so it will be there for years to come. You know, 1 in 78 is diagnosed with it, and it's like 14,000 women a year are dying with ovarian cancer, and they don't even know it until they're stage 4. And it's a very painful cancer to have, and it's treatable. It's totally treatable if you can catch it, and just be aware of it and advocate for yourself. Speak up. Don't just go for your annual visit and not speak up. And if they're not giving a good full screening for health screenings, family health history, you need to speak up and give it to them, because doctors are only putting the pieces of the puzzle together and they get the information from you. So, and you just have to advocate for yourself and speak up and ask to have the blood work done, ask to have, your health screenings put in there, and just use your voice. So Teal Tuesday, every Tuesday in the month of September, we on our Facebook and media pages, we're going to have Teal Tuesday, which you tune in. There's going to be graphics on there that talks about, educates communities and families about what ovarian and cervical cancer is. And we're asking everybody to tag their friends, families, neighbors, or your new best, somebody you just met. Tag them, share it on their own social media, and just get the word out there. There is no funding for cancer, and it's the biggest epidemic here in the U.S., especially in Hancock and Washington County. Washington County, in the state of Maine, has the highest mortalities and cancer-related illnesses than any other county in the state. Nationally, for lung cancer, they're number 1. Colorectal cancer, they're number 3 nationally. Breast cancer, they're number 1. I mean, just about all of the cancers, number 1 in the state. There is no services, there's no funding, there's no grants out there that can help you to help these patients. Most of them, what happens is, they live in poverty and they don't go to their primary care. They use the emergency room as their primary care, and then once they get that sick and they're going to the emergency room, it's stage 4, stage 3, stage 4. And a lot of times they don't have vehicles, or they only have one vehicle, and somebody's got to get to work, but somebody, you got to get to your treatments. They're like 2, 3, 4 hours away from a treatment center, and that's one way. So if you're traveling 3 hours to get to a treatment center and you're sitting in a chemo chair for could be 7 hours, depends on what your cocktail is, then you got to drive home. There's no services for these people, and nobody wants to talk to you about it. The statistics show, and I'm going to say this and I'm going to get myself in trouble, but I'm not passionate about it. Statistics show in Washington County, more people die from cancer-related illnesses than they do addictions and overdoses. And they will give you whatever you want. If I say my cancer patient has an addiction, I can get money. But if I say my cancer patient needs to get somewhere, there's no funding for that. And that's sad that we can't take care of our whole community. We can only take care of what it is right now. So that's my thing, and it's got to start from the feds. They can federal funds to the states, but the states can use that money to give out funds for cancer patients and to help them out. Thank God, the state of Maine has the Maine Cancer Foundation that does give out grants and funding, helps with transportation. That's how I started the navigation program. The Cancer Patient Navigation Program is through a grant through the Maine Cancer Foundation. But we need more funding than just that. Most women believe that if they have their annual pap smears, they're okay. Pap smears is not a screening for ovarian and cervical, for ovarian cancer. It's cervical, but not ovarian. That's not going to tell you if you have it. So don't feel safe that you go and have your annual pap smear, because that is not a screening for it. They shouldn't live in fear, but they should have knowledge and have a voice and know their body and speak up for what their body's doing, because nobody knows it better than you. So you should feel comfortable in having a voice and say, hey, this is going on, what is it? And not be afraid of that, because there's no question or anything that you can ask is irrelevant. You need to ask it, because if you don't ask, no one's going to know. And if you don't ask and it comes up, it could be too late. So use your voice.